In this module, we are going to look at manual handling for our volunteers. Let's start by looking at the session overview. Learning objectives. This training will cover what type of tasks are considered to be manual handling, common manual handling injuries, spinal awareness, postural awareness and lifting technique, the legislation relating to manual handling risk assessment, different types of manual handling equipment, and how to undertake a dynamic assessment to move an object safely. Introduction into manual handling. Manual handling is the transporting or carrying of a load by hand or physical strength. This includes tasks that involve lifting, lowering, pushing, pulling, holding, or carrying something, such as an object, animal, person, or something that is pushed or pulled, such as a wheelbarrow or lift truck. Manual handling also includes intentionally dropping or throwing a load, whether into a container or from one person to another. Introduction into manual handling. Manual handling is the transporting or carrying of a load by hand or physical strength. This includes tasks that involve lifting, lowering, pushing, pulling, holding, or carrying something, such as an object, animal, person, or something that is pushed or pulled, such as a wheelbarrow or lift truck. Manual handling also includes intentionally dropping or throwing a load, whether into a container or from one person to another. Common manual handling injuries. It is important that you pay attention to and use good lifting and handling techniques in any manual activity, no matter how small. If you do not, there is an increased risk of injury. Here are some examples of the most common types of injuries that can occur. Lifting loads can lead to lacerations, cuts, and abrasions from contact or impact. Spinal injuries, such as disc lesions, herniated or prolapsed discs, hernias, wear or trauma to the bones, muscles, or other tissues of the back. Pushing and pulling can lead to cuts and abrasions from contact or impact. Musculoskeletal injuries due to the combined stress on the spine from the use of abdominal and back muscles. Crush injuries. Functions and components of the spine. The spine is one of the main components of the skeleton and has a natural S-curve under normal conditions. The spine performs vital functions, and it is important that we are aware of its importance and know how to care for it. The spine provides the central support of the body, and this allows for movement and to protect the spinal cord. Components of the spine. 1. Vertebrae. These are sections of bone that make up the spine. There are 33 in total. 2. Ligaments. The function of ligaments is to hold muscle to bone. 3. Intervertebral discs. The main function of these discs is to absorb shock and to act as a spacer between the vertebrae. Regions of the spine. The spine is divided into 4 regions: neck or cervical region, chest or thoracic region, lower back, lumbar region, pelvis, including sacrum and coccyx. Good lifting technique. The correct posture during manual activities can significantly reduce the strain on the back during these activities. Head. The head has 3 functions in manual handling. 1. Pause and think, plan before lifting. If there is enough room to complete the task, is everything needed within easy reach? Do you need assistive devices or help with manual handling? Where should the load be placed? Can you move obstacles out of the way? For long distances, you may want to walk the distance and take breaks, such as resting on a table. 2. Communicate. Talk to your partner when you complete a team move. 3. Look in the direction of the move. Looking at the floor causes your whole body to lean toward the floor, putting strain on your back. Remember to look up. This brings the body forward and up. Good lifting technique. Arms and upper body. Arms should be bent with elbows as close to the body as possible for optimal spinal support and relief. Avoid twisting your back or leaning to one side, especially if your back is bent. Make sure your shoulders are level and pointing in the same direction as your hips. Get a good grip on the object that you are moving and make sure your hands do not catch or twist as you move it. Keep the load close to your body as long as possible while lifting with the heavier side of the load against your body. Feet. Your feet should be flat on the floor, about shoulder width apart to maintain balance. Your feet should point in the direction of movement. Be sure to wear loose, comfortable clothing so that you can maintain good posture while lifting, and appropriate footwear such as flat shoes so that you can maintain your balance. Good lifting technique. Spine back. The buttocks should be down and outward to maintain the natural S-shaped curve of the spine. Assume a squatting position. Arms. When picking up an object from a low height, try to keep the arms within the boundary formed by the legs and get a firm grip. Knees. The knee should be slightly bent, but not too much, as this reduces the strength in the leg and gluteal muscles. These are the large muscles in the body and should do most of the work during manual handling. Remember that you should not strain your back while lifting, as this can cause injury. Legislation. The main legislation governing manual handling of loads in the workplace is the Manual Handling Operations Regulations. Their main aim is to prevent injuries, not only to the back, but to all parts of the body. It requires employers to consider the entire handling operation, including the external physical characteristics of loads that could interfere with gripping or cause direct injury, such as uneven surfaces, sharp edges, hard to grip objects, or extreme temperature changes. The regulations require employers to avoid manual handling tasks whenever possible, assess the risk of injury if manual handling cannot be avoided, reduce the risk of injury in hazardous manual handling tasks to the extent reasonably practicable. Legislation. The Health and Safety at Work Act 1974 obliges employers to ensure as far as possible the health and safety of their employees, volunteers, and other persons who may be affected by their work task activities. The Management of Health and Safety at Work Regulations 1999 requires employers to consider the hazards and risks associated with work task activities and, when significant risks are identified, to conduct risk assessments, implement control measures to reduce risks to acceptable levels, and document and communicate the results. Responsibilities. If your volunteering role involves manual handling of loads, your supervisor will discuss with you any procedures, risk assessments, and training needed to perform the tasks safely. As a volunteer, you are responsible for following any instructions or information about safe work practices. This includes the correct use of equipment provided for your safety. You must inform your supervisor of any additional hazards you identify. You are also responsible for conducting dynamic risk assessments for handling tasks, including evaluating the space around you and your own capabilities to ensure that you do not endanger yourselves or others. Manual handling risk assessment. Your supervisor is responsible for ensuring that a suitable and sufficient risk assessment has been conducted for all known manual activities in the workplace that pose a significant risk of injury. Supervisors may need to consult with volunteers directly involved in manual handling to ensure that all hazards and risks have been considered in the risk assessment, as they may not be directly involved in the activities. Manually handling risk assessment. The results of the risk assessments must be documented, brought to the attention of all persons who may be affected by them, and reviewed periodically or when significant changes occur. How detailed the risk assessment needs to be depends on a number of factors, including the level of risk and the complexity of the tasks to be performed. This is explained in more detail on the next slide. Risk assessments are conducted not only for the most common types of manual activities in the workplace, but also for any non-routine activities that pose a significant risk. Sometimes this can be done through a dynamic risk assessment, which does not need to be documented and takes into account the immediate environment in which you work and the impact it may have on your health and safety, or that of others who may be affected by your activities. Manually handling risk assessment. The Health and Safety Executive, HSE, provides a brief guide to manual handling at work, which includes a lifting and lowering risk filter. See illustration. This can be used to determine whether a manual activity poses a low or high risk. If there is a high risk, a more detailed risk assessment must be documented. To view the HSE guide, visit www.hse.gov.uk and search Manual Handling at Work, a brief guide. Manually handling risk assessment. Manual handling risk assessments can be split into four specific elements referred to as TILE. Task, what does the task entail? Individual, who is carrying out the task and their capabilities. Load, what is being handled. Environment, where is the task being carried out? Let's look at TILE in more detail. You will now be shown several examples of potential hazards for manual handling tasks and look at the different types of control measures that can be used to help reduce the risk of injury. Manually handling risk assessment, TILE. Does the task involve hazards? Supporting loads away from the body. strenuous movements such as twisting, stooping, or reaching upwards, large vertical movements, carrying over a far distance, demanding pushing or pulling, continual handling, risk of sudden movement of loads, inadequate recovery time, time frame imposed by a process. Make the task safer by control methods, utilizing a lifting support aid, improving space layouts to improve efficiency, reduce the amount of twisting, stooping, and reaching, steering clear of lifting from floor level or above shoulder height, specifically heavy loads. Limit carrying over distances. Avoid continual handling. Diversify tasks to give one set of muscles to rest while another's are in use. Manually handling risk assessment. Will you require significant capability, e.g., excessive strength or endurance? Put yourself in a position of potential harm if you have a health condition or learning physical disability, are returning to work after a recent manual handling injury, are new or expectant individuals, are inexperienced, new or temporary workers, young and older workers, require additional or tailored information or training. To make the task safer, could you reconsider the task layout, use additional handling aids or support, be given more information, e.g. about the variation of tasks, be given additional training, get support from occupational health if required. Manually handling risk assessment. Is the load heavy, large, or unmanageable? Difficult to hold? Unstable or likely to move unpredictably, e.g. box of unsecured items? Unsafe, e.g. sharp-edged or hot in temperature? Carelessly stacked, too high for the individual to see over? Can you make the load lighter in load or size, easier to hold, or more secure? Manually handling risk assessment. Within the task, are there postural restrictions, uneven, obstructed, or unsafe floors, variations in elevation, hot, cold, humid conditions, strong air or wind movement, reduced lighting conditions, restricted movement or posture due to clothing or personal protective equipment, PPE? To make it safer, can you remove obstacles to allow more freedom of movement? Wear more suitable flooring and or anti-slip footwear? Avoid steps and elevated ramps? Avoid extreme heat and cold temperatures? Enhance ventilation? Increase lighting? Avoid working in windy conditions if outside? Wear protective clothing or PPE that is less restrictive. Wear appropriate clothing and footwear. Handling aids and equipment. Various equipment and handling aids can be beneficial to help move a load or item more safely. Examples include sack trucks, wheelbarrows, trolleys, garden trailer, roll cages, pallets, and hoists. Manually handling risk assessment continued. Although the use of handling aids and equipment to move loads safely can be beneficial, there are a number of things to consider when assessing risk. Consider, is the equipment of the right type for the task at hand? Is it well maintained? Are the equipment's wheels suitable for the floor surface? Are the wheels smooth running? Is the handle height between the user's waist and shoulders? Are the handles in good condition and comfortable? Are brakes available? If so, do they work? Can the risk of injury be reduced by providing equipment that is better suited to the task in hand? Performing planned preventative maintenance to avoid problems? Replacing wheels, tires, and/or flooring to make equipment easier to move? Provide better handles and grab bars? Make brakes easier to use or more reliable and effective? Handling aids and equipment. Even if a risk assessment is already in place, it is always advisable to perform a quick dynamic assessment to evaluate the risks before starting any manual handling. Before lifting an object, consider the following things first. 1. Do you need to lift the object? 2. Can you use a cart or lift truck instead? 3. Can you avoid moving it? 4. Can you break the object down into smaller pieces? If lifting cannot be avoided, there are a few more things to consider. Have you checked the weight by identifying the contents and trying to push it with your hand or foot? Is the item too heavy to lift on your own? Do you need help? It doesn't matter if others can lift it, you must not exceed your own lifting ability. Have you inspected the item for sharp edges or splinters? Is your path clear and free of obstructions? If you are lifting with the help of a colleague who will take the lead, have you communicated properly and agreed on the direction of travel? Moving an object safely. Incorrect lifting of heavy objects can result in injury. If a risk assessment indicates that lifting is unavoidable, the following steps are a reminder of the correct procedures for moving and handling lifting objects. Step 1. Before you start the task, think about the task itself. Is it within my capabilities to lift the weight? Where is the object going to be placed? Is that place and the route to it free from obstruction? Do I require any support? Step 2. Start in a comfortable and balanced squatting position, with the legs slightly apart and the load to be lifted held close to the body. Step 3. Ensure that a safe, secure hand grip is obtained, wearing gloves if needed. Step 4. To lift the load, ensure your knees are bent, maintaining the natural S-shaped curve of your spine. Hold the load as close to your body as possible. Step 5. To raise the load, straighten the legs using the powerful thigh and buttock muscles to make the lift. Step 6. Whilst carrying the load, keep it close to the body, with elbows tucked in to reduce strain on your spine. Step 7. To lower the load, follow the process in reverse. Ensure the knees are bent, maintain the natural S-shaped curve, adopting a squatting position. Moving an object safely continued. The application of this lifting method will be more comfortable, protect your spine from injury. Remember that it is your responsibility to lift safely, using good lifting technique every time you lift, and only lift within your own capabilities. Safety tip: make sure your activities do not endanger others. Never walk backwards when carrying a load because you cannot see where you are going and could trip or bump into someone or something. Finally, let us summarize the key points of this manual handling training. Key points: what type of tasks are considered to be manual handling? Common manual handling injuries: spinal awareness, postural awareness and lifting technique. The legislation relating to manual handling risk assessment, different types of manual handling equipment, how to undertake a dynamic assessment to move an object safely. Thank you for completing this manual handling e-learning module. Now please ensure that you complete the short evaluation on this module.